Is it possible to know for sure that your shoulder pain is coming from your rotator cuff? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best, regardless of age or injury. When you're suffering shoulder pain, it can be really hard to know if it's a serious injury causing your shoulder pain. And since rotator cuff issues are so common, because so many people assume their shoulder pain is coming from a rotator cuff injury, it's worth knowing what to look for. Now, the rotator cuff is a group of 4 muscles and tendons that connect your arm to the shoulder blade. They help stabilize your shoulder, stabilize the ball inside the socket, while the bigger muscles move your arm up overhead, out away from your body and behind your back. Rotator cuff injuries can range anywhere from just impingement of the rotator cuff tendons to partial tears to complete tears. Impingement's a condition, and a painful condition, when your rotator cuff tendons, or at least one of them, becomes trapped under the space under the tip of your shoulder blade. That causes pain, it causes stiffness, decreased range of motion with activities that you do. Partial tears of those tendons usually are treated with physical therapy to strengthen the muscles around your shoulder so they're better supported, taking pressure off the partially torn tendon while you're doing overhead objects or overhead motions, lifting, throwing, anything like that. And if those don't work, then sometimes you need surgery for that partial tear to get it to heal. Sometimes if you have a partial rotator cuff tear that doesn't heal, sometimes that can progress to complete tears. Now, some common symptoms of a rotator cuff injury. These are things like pain when you reach overhead, pain when you really reach out away from your body, and pain when you reach behind your back. The pain a lot of time is not so much in your shoulder, but in the upper arm. Sometimes you'll notice that you have pain that radiates down into your hand. That's not really common with rotator cuff problems. A lot of times when you have a patient with shoulder pain that goes all the way down into the hand and fingers, especially if there's numbness and tingling, it's actually a sign that there may be a nerve or disc injury in the neck. Now, if you have shoulder weakness in addition to your pain, that may more indicate a tear of your rotator cuff. If a doctor suspects a tear based on pain, weakness, especially with his or her exam, that doctor will likely get an x-ray of your shoulder, but also very likely an MRI. The x-ray, painless test, small amount of radiation looking at the bones. An MRI is an imaging technique using these magnetic fields to produce really detailed images of structures within the shoulder, ligaments, tendons, muscles, cartilage. And if you have a rotator cuff injury, especially if it's impingement or partial tears, the doctor will likely send you to a physical therapist to try to get that better. If it's a complete tear, you're very likely going to hear that you need surgery to repair it. The surgery will basically reattach that tendon down to bone with sutures and anchors to hold it in place. And then there's a long period of rehab to get you back to full activity. But that process is long. It can take up to 6 to 12 months. Hopefully this video has helped you better understand your rotator cuff and the symptoms of a rotator cuff injury. If you think you have one, it's worth seeing a doctor or an orthopedic surgeon that specializes in shoulder injuries to get a proper diagnosis and treatment. I'd love to hear your experience with your shoulder injury. Leave those in the comments below. Just know I cannot offer you medical advice in the comments, but I do try to answer questions in future videos. Also, make sure to subscribe to my channel, click the bell to be notified when I release a new video, and start another live stream, including my weekly or almost weekly Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.